So the first scheduled break during the masterclass, in the first day of this year, 2022, and many participants may be attending this for the first time. You can come on screen now. Okay, unmute the video so that. Are you able to start the video? Yes, Dr. Darshana can unmute also. And yes. So, yes, ma'am. Over to your inputs.
Yes, sir. Very nicely. I think it's very important to know more about the visceral organs when we are going to treat the patient with the somatic dysfunction. So we should know more about the visceral also, because sometimes our treatment mismatch with the somatic and visceral. So how you have started, it is very important to differentiate between the visceral dysfunction with the testing with the articular and myofascial and neural component. All are very important here to check with the, if we are like you were explaining for the heart, so how we can check with the muscular, that myofascial, that is very important with the muscle which are related close to the heart, the chest wall, that is the pectoralis major, minor, and the articular, that ribs movement with the finger movement of ribs, how we can check the positioning also for the articular part. And with the addition with the dura mater, the loading of dura mater and the sciatic nerve loading with the lower limb activity, we can check it. And the upper limb activity, either the dysfunction is the somatic or either the dysfunction is the visceral, because if we are talking about heart, so we are sure that it's a visceral or somatic. According to that, we can clear all the articular, myofascial and neural. So I think it's a very, this course will give us more light towards this, so that we cannot mix our treatment and worsen the symptoms of the patient without knowing the knowledge of visceral organs. So it's important. I think it's a very wonderful concept which you have selected, that we are treating the visceral, and through the, if the somatic is primary or the visceral is primary, we have to cross check both the condition. That is very important here. And our assessment and evaluation is very important, so that we can move forward towards our treatment plan.
Good.
Thank
that you
sir.
brought that what is called as somatovisceral.
Yes, sir.
That is, somatic problem is major. Okay. Then what will happen is patient will come with thoracic pain.
Yes.
A thoracic discomfort. Thoracic facet, no problem. Spine, vertebral column, no problem. Costovertebral, costotransverse, the joints in the thorax. That is not a problem at all. You are checking the back muscles, upper back, middle back, everything, myofascial structures, that is also no problem. You are doing the neural assessment, but still you are not able to exactly reproduce the patient's symptom. The patient tells somewhere vague discomfort like that. Then you are nowhere if you are an untrained therapist. But if you are getting the perspective of visceral, immediately you can know that at T4-5, if the pain is there, get back to the cardiac assessment and do the same, the cardiac pressures anteriorly. And after that, you might find the thoracic pain in one direction, it will be reproduced. In the other direction, it will be relieved. So that is like somatovisceral.
Right.
Patient comes with somatic symptoms, but it's not from the somatic structures, associated dysfunction of the viscera. Viscerosomatic, what happens is, it's a visceral disorder, visceral symptom. Associated somatic dysfunctions are there, where we maintain that somatic position and we treat the viscera mechanically. Okay. So this both extension of the mechanics of the viscera is the one that is difference in the viscerosomatic manual therapy of AOMPT. Whereas if you see for the osteopathy, it is individual. They either treat the viscera and see the effect on the osteo or the somatic. They treat the somatic and they see the effect on the viscera. They don't treat interdependently. And next, if you see visceral manipulation, which is again focusing only on the viscera. So it's not at all talking about somatic. Okay. And it is more of structural treatments. None of them are getting into the physiological aspect. which is like what is called as the ejection fraction in the case of the heart. It is the systole versus diastole, how much the blood is filling versus pumped out. Okay, how much the blood is entering, how much the blood is pumped out. It is again measured with Doppler, the ultrasonography. So remember that physiological impact is much important for functional recovery, and biomechanical is also very important for interrelationship between the systems, be it the visceral versus the musculoskeletal. Okay.
Yes, sir. I think that ligament which you have shown with the sternum to phrenic and the thoracic, it's also very important to know more about the ligament which are related to all these three parts. If they are in a misalignment or there is a stretch or uncomfort of feeling according to the rotation, so we can also check this, the positioning of ligament. That is also very important, which you have shown by practical. That is also very important to learn more about the visceral organs. Their ligaments,
Today is a surprise. It is like, because Dr. Sharik was there, I'm showing it on him. Otherwise, it would have been more of with only our chief guest. And of course, the lecture slides. Okay, the slides actually you have seen that in full description, detailed webinar masterclass, which is the bonus video. So people who are actually successfully completing this webinar will be receiving that visceral manipulative therapy. Okay, there the somatic focus was not made in that webinar. Okay, the masterclass which I took last year as part of the osteopathy series. Today's the lecture PPT. It will be like 10 to 15 minutes, a rush through of overview or what is called as just to see the theoretical contents behind. Okay, so that is the objective in today's session. So when it comes to the clinical approach, I want the participants to get the orientation, how visceral is very important, and the next, the inner vision, how AOMPT is more important and more different in providing instructions, okay, to make the topic to be enjoyable and also educational. Okay.
Yes, sir.
Darshana is in the car. I don't think other participants are able to unmute the video. One of the participants, Dr. Alisha, has texted that video is not visible, something in the chat.
Yeah, everything was clear.
Yeah, if there was a video, any kind of interruption, immediately you only would have alerted through the audio at least. Maybe the internet connectivity will influence the video. That is why we are giving the video recording for the course enrolled participants. Today's free webinar participants, don't think that I'll send you the video recording. Core committee who are enrolled, they are already enrolled in the Vsmt main course. So that is not a problem with them. Okay. So we're going to continue with the next section, which is actually more to do with this model. I wanted to actually show how these parts are fitting into this model and make you to understand this human life size model for the visceral anatomy perspective. Okay, so that's the short one now. So I'm going to remove the heart from Dr. Shari, the outer heart, and we are going to again reassemble this together, myself and Dr. Sharik. Okay, so here again, one will be closer view and the other one will be the longer view, how we both are doing. Okay, so that we are making the chief guest to be happy that he has got back into shape. Now he is, okay, absolutely like looking like empty. Okay, so everything is removed. Okay, only the diaphragm is there. Okay, so I will also explain what are the structures that are visible here in the front on the model. Okay, so that you understand this perspective, and having such a model, which is either of life size or it is a smaller size, whichever, will make your 3D perspective of understanding these organs better. Okay. Remember that the heart which I fixed on Dr. Shari, if it was not a separate one, and if I am making a diagram of heart on his body, how much will be the understanding? So always the 3D perspective will improve when you are purchasing these anatomical models. And when you are joining the VSMT course, parallelly when you have such models, you can utilize the knowledge that is given in the course better. You can also use this to explain the patients, right? Smaller ones, not the big one. This is almost worth 75,000, okay, in Indian rupees. I'm not recommending this, and I'm neither getting any commission from the company, okay? So what you do is buy the smaller ones, whichever is nearby, by the supplier, or it may be in Amazon. So you can purchase them and make sure that utilize judiciously.